Hello there, it's Margaret, consultant psychiatrist on a transition from clinical psychiatry to preventative mental health. And the purpose of this video and others is to share parts of that journey with you, as well as other bits that come up along the way. I work and live in the United Kingdom, and you can find me on various social media platforms at the handle at Dr. Maggie Prevents. Today I want to talk a bit about the three P's, or honestly, I think I started with two or three P's, and after a while I lost track of the P's. So some of the P's include prevention, process, perfectionism, and we'll see if any others come up along the way. Choosing to transition was on account of various factors, including long-standing interests and um, the current climate in the United Kingdom and beyond, and within mental health in general around the world. And it just seemed like a decision whose time had come. That said, it has come with its own share of opportunities and challenges. And one of the things I found interesting is that this transition has been a process. So it wasn't possible to just wake up one morning and say, okay, that's it, I'm done with psychiatry, I'm going to focus on preventative mental health. No, it's been a process where along the way I've continued to do some psychiatry, as well as a few other things, and some preventative mental health. And for those of you who work in healthcare in some way or the other, you would know that different parts of the system move at different speeds. For instance, if you've worked in acute physical health for a while and then you have to work in psychiatry, you might be surprised at how slowed things might feel relative to your acute physical health role. But then coming to work in preventative health or public mental health, you will notice that things can be even more slowed in terms of processes, outcomes, and at what point you get to see the results you hoped for. And so that has been interesting for me in this transition process because some of the things that I put in place for this transition a few years ago are just starting to see fruition now, and some are still honestly pending. And that can be frustrating, but reminding oneself that these things take time can be reassuring. And, starting to see some of the results is also very validating, right? Now, some of the results I've started to see are related to the work I'm doing with the Royal College of Psychiatrists. I've been able to support them on their Preventative Mental Health Leadership Certificate course, both last year and this year. In fact, just yesterday, we had a webinar with participants from around the UK and beyond. And there are a few other preventative mental health bits that are going on. There's a conference in London tomorrow, which I'm looking forward to attending. I can't wait to meet up with some of the people I've only met on Teams or Zoom or similar platforms, and to meet some of the people I've met before, but to see them again. Also, there are some medical education sessions I've held on preventative mental health for psychiatry registrars in different parts of the UK. A number of times in Manchester, a number of times even a number of times in other parts of the country. I've done some work, a team session, but with trainees in Cornwall. I presented at a liaison psychiatry conference in London on achieving prevention by collaboration. But there are also things that we're trying to figure out how we can support our psychiatry registrars throughout the UK and beyond to get more involved in preventative mental health and more aware of the principles and the way they can participate. Now, where does perfectionism come in? If you are like me, and one of your tendencies can be to strive for perfectionism, that can be a good and a not so good thing. And sometimes that can lead to you spending more time on things than you should. And so over the years, I have had to learn to, redirect my efforts to spread them wider to achieve more things rather than focusing on just one thing. And that has been a learning process that I'm still going through. And in CAT, one of the things we encourage people to think about is to think about getting things to a stage where they're good enough. It might not be perfect, but it's good enough, right? And that has been an interesting challenge for me, even as I've tried to, work on this transition. But reminding myself that imperfect is okay, right? Good enough is okay. Just get on with things, right? That has been very helpful for me. And even in terms of making videos and posting on social media, because I struggle with that, sometimes I'm like, oh no, the video has to be a certain way. I can't have the ring light show in the reflection of my glasses, or oh, is this right or that right? And honestly, recently I just said, I'm going to put the videos out there. If they're perfect, great. If they're not, which they likely won't be, that's okay. You'll get the message, right? If I, have to repeat something or, whatever. The essence of this is to share my journey with you, which I will do. And some days, it will be, bright, happy video. Other days, it'll just be just get that video out there. But I do think that reminding myself that good enough is okay and imperfection is fine. We are all imperfect. None of us really ever achieves perfection. And so I thought it would be a good opportunity to remind any of my fellow perfectionism strugglers out there that good enough is okay. All right? Imperfection is fine. Okay? As long as we're meeting the basic standards of whatever we're doing and trying our best, then, just do what you can. Don't run yourself ragged. I'll stop there. It'll be interesting to hear your thoughts and comments. Again, I'll add my caveat that please remember that videos and advice and comments from this channel do not replace advice, care, and treatment from your primary and specialist care providers in your local area. Please do appropriately contact and engage with licensed professionals as the need arises. And a couple of our slogans, which I try and say when I remember. Prevention saves lives, and that includes mental health prevention, right? Together, me and you and everyone else, let's optimize our mental health. See you next time. Bye.